Good evening all. I am Archana, Assistant Professor from SNS College of Physiotherapy. So today we are going to see about the management of scoliosis. Scoliosis is nothing but it is the lateral curvature of spine. So today we are going to see how you will manage while a patient is having scoliosis. So the most thing you need to remember in scoliosis treatment is 4 O's, that is observation, orthosis, operation and other measures. In the observation, if the curve is less than 20 degree, you will only need observation. If the curve is above 20 to 40 degree, you need to prescribe orthosis, and if the curve is more than 40 degree, you need to go to operation, and other measures like you can go with physiotherapy treatment. So moving on to the non-operative methods, that is the conservative method. So this consists of strengthening your muscles that support your spine. Then what you can do is orthosis you can prescribe, that is the Milwaukee brace, Boston brace, then Bruce's turnbuckle cast brace. Okay. So if you see that, then you can see there is another cast, that is localizer cast. Okay. So if you see this figure, you can see these are the orthosis you can prescribe for a patient with scoliosis. Now this is the cast, that is turnbuckle cast. You can see that there is a turnbuckle cast that is providing the support to the spine and it is preventing the lateral curvature of the scoliosis. And you can see that is the localizer cast. What they do is, they will do a spinal traction and they will align the spine in normal direction. The patient will be put in that localizer cast, and that cast will be having a traction all of the time. Now moving on to the physiotherapy management in scoliosis. So physiotherapy management is prescribed if the patient has a curve less than 40 degree. So mainly if there is posterior scoliosis, you can prescribe physiotherapy. So for that you can do screening methods. How you will do screening methods? You can do tests like forward bending test, then you can do side bending test, then you can do with the scoliometry you can assess the angle. Okay. Then with the radiograph you can assess the pop angle and you can see how much weight the angle is. Okay. If it is less than 20 degree, only observation. If it is more than 20, you can prescribe orthosis as well as physiotherapy. Okay. Then you can go with the posterior correction. Now the active method, that is if a person is doing selfly correcting the scoliosis, what they can do is they can position the curve. Wherever the curve is identified, they need to find out. Then patient is instructed to adopt that position. What is the problem he need to identify, and he need to adopt a position that is limiting that curvature. Okay. Then passive method is unequal traction. That is nothing but the patient is instructed to hang in a suspension bar, and that can help him to correct the spine. Then is the axial traction, that is provided by the therapist. Physiotherapist will provide the axial traction. For that, patient should be in supine position, and what the therapist do is, the therapist will keep the traction in opposite direction. They will keep the hand over the occiput and the chin and over the leg, and they will put the traction with the hands. Okay, so that will help to obtain the correction. Okay, you can see that along the direction of neck and pelvis, one physiotherapist will put a traction, and along the direction of your chin and occiput, other physiotherapist will put the traction. So there will be counter traction that will provide the correction. Now, what we need to do is proper education. We need to teach the posterior correction exercises. Then other exercises like deep breathing exercises if there is thoracic scoliosis, and you can prescribe active range of motion of the spine, because scoliosis will limit the range of motion. Then you can provide the strengthening exercises, because the spinal muscle will be going for contracture. On the convex side, it will be going for lengthening. On the concave side, it will be going for the contraction. So we need to stretch the contracted area, and the convex side, what we need to do? We need to do the strengthening, and also to the parallel spinal muscle, also we need to do the strengthening. So these are the management we can give for a person with scoliosis. Thank you.